Hey everyone, welcome back to Staying Connected. This is Katie, your host, and today I have Kristi with me who's going to talk to us about her story with vascular Ehlers-Danlos syndrome. Hey Kristi.
Hi, Katie.
How are you?
I'm doing great. How are you?
Good. It was really great meeting you this weekend in DC. I know we've already talked about that, but I really can't express it enough.
It was really great. And the food was good.
There was good food. So I wanted to talk to you about your story with vEDS. I know that yours is you've had vEDS for pretty much all of your life. Can you tell us about that?
Sure.
So how are you diagnosed?
Okay, I recently turned 45, and I was diagnosed at 5, so I've definitely known my whole life. And when I was diagnosed, it was first clinically, and it took about a year to get the results back. And then, of course, the tissue sample that was tested came back to confirm the clinical diagnosis. Um, And at that time, when they did the tissue biopsies, they did not want to disturb any of my surrounding tissue. So they literally just pinched my skin, pulled it up, and cut it off.
Oh,
Yeah, it was hard. I vividly remember it happening. I was 5 years old, and my grandmother and my great aunt Shirley were in the room with me at Cincinnati Children's Hospital, and it was hard. But the reason that happened was because my father had passed away. Um, he had a colon rupture, and he was undiagnosed, and he literally died in our kitchen one evening. He had been walking around, hiccuping really loud, holding his chest, and he collapsed. And when he collapsed, he hit the cold air return on the floor in the kitchen, and it ripped open his skin. So blood started coming out, and I was standing there, and his blood kind of covered up my toes. And my mom was on the phone with 911, and the ambulance came, and he had actually stopped breathing before the ambulance came. And when they got there, they were able to revive him and put him in the ambulance, and my mom jumped in with him, and the two of them left. And I was just standing there at like 10 o'clock at night in the dark outside crying. And then our neighbor came over. It probably was just a few minutes later, and packed up a little bag for me and took me in. And she had 3 kids, so I went with her, and that was it. That was the first house I stayed at. But his hospital stay lasted about 2 weeks. And they, I think, immediately identified that his colon had ruptured, but he was very septic, and they did lots of surgeries, and he just didn't make it. It was just too weak. And he had lots of problems prior to that, and no one had connected them all. So he was pretty weak when that happened.
wow. So
Is
this
that
is
a
when
good
you
one?
were 5?
Yes, yes. I was 5 years old. And then the crazy thing was one of his doctors had just had a patient in Chicago I was living in Green Bay, Wisconsin, and some of the doctors come up from Chicago and do rotation from Green Bay. And one of the doctors had just had a patient who had passed from Marfan syndrome, and they thought for sure that that's what he had. So that's what made them go through a genetic panel during his autopsy, because of this one doctor who just thought, you know what, he has Marfan syndrome. He didn't, but that's what they thought.
Wow. So
And yeah,
this doctor probably wouldn't have even thought about it otherwise.
yes, right. And they may never have even, yeah. I mean, but they looked at me and thought and said, well, she definitely has what he has. And when it came back, it was vascular EDS and not Marfan's. They said for sure she has it, and we're going to do the genetic testing.
Wow. So then what was that like getting diagnosed at 5?
Um, it's so hard because it's wrapped up in my father's death. There's no separation of it. So all in one foul swoop, I was fatherless and diagnosed with this disease that killed him. Um, and it was really scary. It was pretty scary. There are a lot of changes, a lot of adults around all the time, and I'm an only child. Um, So I just kind of was shocked at first and didn't really understand the implications.
Mm-hmm.
But then when I realized, he's really not coming back, I used to travel in my mind. This is the best way I can describe it. I would kind of travel down this tunnel into this empty, dark hole. And once I got to the dark hole, I would have a panic attack. And I could feel it happening. And it was just this sense of nothing is, like, there's no point to anything. Why am I here? At any point I could just die. And my brain just could not make sense of it. And I could just travel down this hole and then have a panic attack. And it was awful. It would just be awful. But I knew I had a little bit of control over it because of that tunnel. So I finally started, probably by 9 or 10, being able to stop in the tunnel rather than reaching the entire black hole. And it would stop the panic attacks if I could get myself to focus my mind on something else. But it took a couple years to figure out how to do that. And and if an ambulance went by, I would have a panic attack, and it was very hard, yeah.
Wow. What did they tell you when you were, like, what kind of resources were out there? What was it like growing up at that young age
hmm
with that?
Well, in 1979, there's no internet. In all the 80s, no internet. And the information we had was from Duke University, and it was one paragraph long, and it was just what they, I think, taught in medical school at the time. So they really told me, protect my abdomen, never take gym class, and never have children. That's what they told me. And they probably didn't tell me not to have children until I was menstrual age, like probably 12 was the first time I heard that I was never supposed to get pregnant. And doctors would make sure that I knew this. They were really concerned. And so, I didn't even think I'd kissed a boy yet. So I didn't really understand that this was my responsibility.
Yeah.
But I said, okay, all right. And so I've never taken a gym class, and there was no sugarcoating it. I mean, I saw my father die, so there was no like, you'll be okay, or we're going to tell her what it's really like when she's older. I got it. I mean, I knew whatever this was bad, and it killed my dad. And so I'd always be, I try to be careful, but you're a kid, so just constant stitches and bruises and injuries. But I think I did okay because I never was in sports, and I never had to. My body wasn't under that kind of stress, so I lucked out in that part, I guess.
So now you're 45?
I am 45, and I still don't even know what to do. Right? I mean, it's so challenging. But like I would say in 2014, I decided I was going to join a gym.
Mm-hmm.
And it was a strength training gym. And I thought, well, as long as I know, if I can talk through the exercises and all this stuff. But 6 months into it, I was so sore and so tired. And even though I was doing very little in terms of impact, it was too much. It was just too much. We're so fragile. So now I just stick to walking. I don't do water aerobics anymore, nothing. Walking. But I walk like 8,000 steps a day.
Well, that's pretty good.
Yeah, I had to work up to that. And I can't do that every day. But yeah, it's pretty good.
That is good. So, what have you been through so far in the 40 years that you've known that you have vEDS?
Well, going back to like my childhood and when I was first told and what that was like growing up with vEDS, and what I've been through, the children in the neighborhood knew something was up with me way before I understood some of these differences. Like I would get teased because my legs bend backwards. They're hypermobile, so they bend back. Or I was teased for my fingers. And in fourth grade, my nickname, it's so long for a nickname, but it was Ethiopian French fry fingers.
What?
It still makes me laugh. But in like 1984, whenever I was in fourth grade, there was always these commercials on for children who were starving in Ethiopia. So
Oh.
that's where and they looked very thin.
Hmm.
So this is where the Ethiopian part of my finger nickname came in, because people were always on TV from Ethiopia. So kids just
Oh my
remembered that.
gosh.
I know my fingers were always so skinny. And I grew up in Green Bay, Wisconsin, and I remember probably in sixth grade, all of us had our first little boyfriends, and we're all in a little group together, like a clique. And some of the other boys that were dating my little girlfriends nicknamed me Skinny Minnie, as if this was a bad thing, right? Skinny Minnie. But then they would say, oh, I would never kiss her because she's too skinny. And it would be
Oh.
like, well, what? What do you mean? And so the teasing and the bullying started probably around then. And it got worse in high school. And it's usually by boys, not by girls. And I don't know if, and we're told this is, as young women, this is what boys do when they like you, is they hurt you, right? Or they throw stuff at you, or they call you names. And it's like, I don't understand this, but the people on the football team used to step on the back of my heels in high school, and they would say, let's see if we can make her bleed, and they'd step on my heel and rip the skin off. And it's full of scar tissue, both my heels. So it was pretty easy to rip that skin off.
Hmm.
Yeah, that was very challenging times. So the
Wow.
bullying, I know, I know, but you know what? All these things like prepare you for your life of dealing with doctors. I swear, if you can't stand up for yourself to the high school football team, you're never going to stand up to a doctor.
So, tell me about the different times you've had to stand up to a doctor.
Um, oh gosh, it's so many. I remember I'm really young, and the first time I asked a nurse not to tie that plastic, or that rubber band so tight around my arm to take blood,
Hmm.
and she tied it, in my opinion, even tighter. And I was like, that can't be. So I was always doing these tests in my mind. So if I said this, what reaction would I get? So when I told her that I'm very fragile, she seemed to tie it tighter. So I used to practice telling nurses, am I going to tell this one to tie it tighter, or this one, am I not going to say anything and see what the result was? And it's like, if you tell people how to do their job, they get a little mad.
Yeah.
I've noticed this. Same with doctors. So whenever I've pushed back or demanded some sort of curiosity, I've usually get called names. I've been called drug seeker, drug addict, faker. One time I waited. I was having surgery, and my plastic surgeon, who was reconstructing my hand after a horrible injury, that was complicated by vEDS, of course, he wanted me to go see a rheumatologist before the surgery, because this plastic surgeon didn't know much about EDS or vEDS, but he thought for sure I did not have it. And I was like, okay, I'm pretty sure I do, but okay. So, so I think I got on the waiting list. It was 12 to 14 weeks, and I'm putting off my hand surgery till I see this rheumatologist. So I finally get in to see him, and he looks at me and says, yeah, this could be EDS, but I got to tell you, I'm only interested in scleroderma. And I was like, what does that mean, you're only interested in scleroderma? And he's like, well, it means those are the only patients I'm taking on right now, and I've no interest in your case. And
Wow.
I was so frustrated because my surgery was being put off that I just cried. I just cried. I couldn't even, I was so frustrated and so shocked, and tears came out, and he referred me to not even a therapist, a psychiatrist.
What?
He referred me to a psychiatrist because I cried in his office. I was like, wait, no, you're being so rude and dismissive. What do you
Yeah.
mean? So it's just constant. And then when I finally had my hand surgery, that doctor sent a sample of my tissues to Dr. Peter Byers in Washington,
Hmm.
and I came back a second time positive for vEDS. And then when that diagnosis came back. My doctor called me at home, and I'd forgotten he sent the sample in. I was not at home thinking, oh, I might not have this at all. And so he called me and said, I need you to come to my office and please bring your husband. And I was like, okay, no problem. So I show up. I show up thinking, is he gonna, I don't know. Like, I didn't even know what to think. And I show up and he said, I'm so sorry to tell you this, but you have vascular Ehlers-Danlos syndrome. And I said, yeah, I know.
Oh my
And he
gosh.
said, well, the bad news is you really shouldn't have children. And I said, again, my husband that you're talking to with me is 20 years older than me. You don't think I planned this out? He's had a vasectomy. Like, I understand this. But it was, he really was emotional and felt for me. And then I realized when I left his office that I am the person with vEDS consoling him because he's having trouble telling me that I have vEDS.
And you already knew.
And I already knew, yeah. But, now he knows.
Oh my gosh. What an experience.
I
To have to go
know.
through diagnosis twice.
And sometimes I just don't know if all people are treated this way or if women are treated differently than men by doctors. I just can't, but I'm hardly believed about anything.
Yeah.
It's just very strange.
Yeah, that's an interesting question because I never really thought about that difference. I know because I'm female, so when I
Mm-hmm.
go to the
Mm-hmm.
doctor, like I've been dismissed in the ER before many times, and I never really thought about the possibility that a man would have a different experience with this.
Yeah, I mean, the rheumatologist, I assume, thought I was hysterical and referred me to a psychiatrist. It's like, I'm not hysterical. I'm so frustrated, and you're being so dismissive.
Yeah. So, with knowing that you've had this since you were 5, were you able to avoid any serious complications as far as like bowel or arterial complications? Or have you had any?
Oh no, yeah. I don't know if I think the awareness has prolonged some of that well, I don't know if that's the right word, prolonged, but so in college, my first major vascular complication was my quadricep muscle ruptured spontaneously. And I didn't even really feel it at first. Like, I was sitting on a couch at like an after bar party at like 4 in the morning. And well, anyway, so I was sitting there, and everyone was ready to leave. We'd all been drinking beer for probably hours. And everyone's ready to leave, so I stand up, and I realize I can't actually stand. I can't put any weight on my leg, and I'm in some serious pain, and I'm like, what is happening? And this was like 1994. So well before the ACA was in law, and I didn't have any health insurance. I couldn't get individual insurance, and there wasn't a group in our campus to join.
Mm-hmm.
So I didn't go to the emergency room because I didn't really understand how serious my disease was. I mean, I did and I didn't, and I just kind of ignored the pain. So then the next day, it was so excruciating, and my roommates went down to the liquor store that was close by and got 3 or 4 bags of ice, and we just packed my leg. For about 4 days, I couldn't put any weight on it, and then I finally was able to stand up and get out of bed and go to the free clinic.
Mm-hmm.
And they were shocked about how my leg looked. Now my leg is so giant, it's swollen, and it's kind of a weird gray color. And they're like, this looks bad. And they just gave me anti-inflammatory pills and sent me on my way. And then a few days later, it happened again, and I was sober, and I felt it all. Like, it just kind of, like I just call it like an aftershock, but I don't actually know what happened because I didn't see a doctor. I just let it heal over the next couple of weeks, and I just get packed in ice, my whole leg. And then I realized about 6 to 8 months later that I was limping. I had like a permanent limp. So it took another couple of years till I graduated from college, till I, moved to Chicago and got a job and had health insurance, that I went on to find some answers. And I had my first appointment with my rehab person or physical therapy, and they were bending my leg in all these ways to try to figure out what's going on. And then we figured out I only had like 3% mobility in that leg.
Wow.
So, yeah, it was pretty bad. But if I'm sitting down, the leg moves fine. But when I'm standing, it's like a whole strange injury. So we think that scar tissue attached to the tendons and stops my leg from moving. And then it took another 14 years before I finally found a doctor to do some surgery to give me a little bit of movement back so I'd stop falling down.
Wow.
Oh, I don't know, did you see my bad hand? I don't think
I
I
didn't.
showed it off. You didn't notice? It's from a cat bite. It required 7 surgeries in 5 years of my life. It was insane.
Wow.
Yeah.
So what
Yeah.
happened?
I was at a dinner party in Chicago, and at this woman's house, and she had said, I'd been there once before hanging artwork for her, and she had said her cat was, they'd just moved from Paris to Chicago, and her cat was not adjusting well, and he was kind of mean and whatever. So he was never around. I never went by him. But then I was having dinner at this dinner party at her house, and her niece were fighting. So I went to the bathroom, and I had to walk past this chair where the cat was sitting. And I was thinking to myself, okay, when you come out of the bathroom, if they're still fighting, just say, hey, I'm going to get a cab. I got to go home.
Mm-hmm.
So I come out of the bathroom, they're still fighting. So I take a second to collect my thoughts, and I reach down and I pet the cat, and he
Oh.
bit through my hand.
Oh no.
Yeah. And I've always had cats my whole life, so it's not like I just was obnoxious. Like I walked over, I let him smell my fingers a little bit. He was fine, and I just pet him under his chin, and then that was it. And I lost the use of my dominant hand for years.
Wow, that required 7 surgeries?
Yeah. I produce massive amounts of scar tissue, which
Yeah.
is a very complicating factor. And I think that like doxycycline, that antibiotic
Yeah.
that people take, I think that stops the production of all that scar tissue, but I can't get Hopkins to prescribe it for me. Oh my God, should I talk about my colon rupture?
Yes, you should talk about your colon rupture.
So my colon rupture. So a couple weeks before my 40th birthday, I woke up. Pain woke me up at like 4 in the morning, and it was bad, really bad pain, but definitely not the worst pain that I'd had. But it was pretty consistent pain, and so I texted my primary care doctor, who had given me her cell phone years prior, and I had never used it. So I texted her and said, hey, I got this pain. I don't even know what to make of it. And she wrote back immediately, have your husband get you some suppositories and see if you can have a bowel movement. And I was like, okay. So this happens. Bob left the house, walked over to Walgreens, got me suppositories. So you can imagine, I'm laying on the bathroom floor trying to insert a suppository with this crazy pain. That's awful pain. And I don't know my colon has perforated yet. And so suppository gets inserted. Now it's probably like 6 in the morning. And nothing, the suppository gets inserted, and I wait 15 minutes. Nothing happens at all. As I call her back, and she's like, you should probably go to the emergency room. And I said, okay. So I went right to the ER, and they were pretty calm. They must have known pretty early on I was septic from my white blood count, I think, right? But didn't really say much. They just came in and said, oh, now we want you to drink all this barium. I'm like, oh, God. And do all this and do this. So I said, okay. So I do all these tests, and then they came in and said, and I'm on morphine, luckily, for the pain. So then they came in and said, well, the truth is you're septic and your colon has perforated, and we've called in an emergency surgeon, and you're going to be in surgery in about 45 minutes.
Wow.
And I know. And I was like, I remember thinking, oh, okay, great. And I looked at my husband, and he looked devastated. And then I was like, okay, I'm not reacting right. I not, I gotta get myself together because I'm on morphine, so I feel pretty great about everything. So I'm like, okay, I gotta collect myself. And Bob was so upset and so scared. And I just remember saying, well, it's going to be okay. And then my surgeon showed up, and he was younger than me. And I said, well, now I'm worried. I don't think this is going to work out. But I'd never met this guy before, nothing. And I get wheeled into surgery, and my plastic surgeon happened to be in the OR, and he saw my name get put on the board. And he came to check on me right before the surgery started. Wow. And that gave me such comfort and relaxation. So I could just be like, all right, this guy thinks I'm going to be all right. This guy thinks I'm going to be all right. So that was it. And then I woke up in ICU, and I've been, had an ostomy. And then they moved me to a regular room. And I stayed there for 10 days till my colon woke up. Mm-hmm. And then they could send me home. And I had my ostomy for about 8 weeks, and then we did the reversal surgery, which was successful. And all that's very risky and stuff, but yeah. I don't know. My surgeon was confident that my body could handle it, and I did. But in less than 8 weeks of time, or about 8 weeks, I had 150 staples, 20 days in the hospital, and 2 bowel surgeries. So I was in bad shape.
Wow.
I lost about 20 pounds. I think I weighed about 98 pounds. About the end of it. How old were you when this happened? 40. 39 and then 40 when I had the reversal done. Yeah.
So you're 5 years out from that now.
Yes.
Everything's good now.
My stomach is different, but it's much better. Much better than I feel good. Than I did. I feel a lot better. I was so weak for probably a year. And then that year I also had a hysterectomy after that. So it was a rough year. 2014 maybe? Yeah, it was a rough one. But I feel good. It went all right. It was harder than I anticipated. And I have adenomyosis, which is severe endometriosis. So from age 33 to 40, or 32 to 40, I was having these monthly siccular pains. So it would happen 2 days after I would ovulate, and it would last until my cycle started. And we were just treating it with pain medicine because I wasn't really sure what to do about it, and I'd seen many gynecologists and yada, yada, yada. No one really wanted to do surgery on me. But what was happening was I had tissue that had grown, a lot of tissue had grown around my uterus, and my uterus would contract every month to get rid of the foreign body so I could have my menstrual cycle. So it was literally labor pains. Wow. Every month for 8 years. So the hysterectomy, while it was hard, I was just so happy not to have that monthly pain anymore because it was, life-altering. It was awful.
Wow.
Yeah, it was bad. That part was bad.
I'm just trying to imagine what that would feel like for 8 years.
Oh my God, I can't even imagine that I did it that long. But it wasn't until I moved to, then after my colon perforated, right after, I moved to Baltimore. And there was a surgeon in Baltimore, Hopkins, who was familiar with all types of EDS, including vEDS, and she's a gynecological surgeon. So I met with her, and she just was like, I can't believe you've been through this. We need to take it out immediately. And I was like, wow. Oh, good, okay. I know, it's crazy.
Wow. So you mentioned earlier that, the resources that were available to you were very, very few when you were first diagnosed and through a lot of your life because of the lack of the internet. So what did it feel like when the internet came about and you found other people with vEDS?
Crazy. It was so crazy. The first thing that I found was the Yahoo groups which were so old.
Oh
And
gosh, yeah.
over the weekend, when we were together and I met Kathy Bone, I was like, remember the Yahoo groups? And she was like, oh my gosh. But I met so many people. Adeline, who passed, she was in the group before she had her baby. And she went back and forth because she really, really, really wanted to be a mother. Um, and then she finally decided to adopt. And so I remember that whole her fretting and going through all that experience about the adoption.
Mm-hmm.
Who else did I meet? I think Tara, maybe from Michigan, that's in our group.
Mm-hmm.
Pretty sure she was in the Yahoo groups. I want to say I met Jody. You know Jody?
Yeah, Jody passed away a couple months ago,
Yeah,
right?
yeah, yeah.
So you met all of them through a Yahoo group
Yeah,
then.
yeah. Yeah, and at that time it was just like a listserv. So you'd get, you either get an email every time somebody replies, or you could sign up to just get their group email. So then you'd get like at the end of the day 100 messages. And I didn't have a computer at home, so all of this was done at work,
Yeah.
which wasn't ideal either. Um, so I would be like, sometimes my boss would come in and I'd be like totally panicked or crying. And he's like, "What's wrong with you?" And I'm like, "Oh, nothing. I just read 80 vascular EDS messages, but I'm fine."
Oh my
They
gosh.
couldn't say that because I didn't want to, you don't really talk about your rare disease when you get your first job out of college.
It is hard though. I mean, that's a really,
hmm
realistically, it's very hard when you read things that happen to other people and, what kind of
Yeah.
effect did that have on you from like, I imagine when you grew up and you didn't have that resource. I mean, you just kind of knew what you knew, right? And that was it.
Yeah. No, exactly. And I kind of felt like, well, I'd protected my abdomen, which everyone said, and I'd made it to adulthood. So I kind of naively thought, well, I'm going to be fine. But but my whole goal was always to get out of Green Bay and to get myself to a big city. I thought it'd be New York, but Chicago turned out to be excellent as well, and to just build my medical team. So I think it was really interesting to meet people or to, get emails from people who had this condition because it meant I wasn't a liar. And doctors did not want to hear from me. They could not help me. They didn't understand what I was talking about. I had my first internist in Chicago, wanted to test me because I was always bruised when I'd come in, and she wanted to do some test to see if my blood was coagulating or whatever.
Mm-hmm.
And I said, I've already explained to you why that is. I don't understand why you don't want to talk about my disease. Why do you think it's something else? And she just went off about how she knew more than I did about stuff. Not EDS, she knew nothing about that, but just that it doesn't make sense what I'm telling her. And she was shocked that I didn't want to know the answers. And I'm like, I have the answer. What are you talking about?
Oh my gosh.
So having more resources available, I'm not sure. I have to really think about how it changes me or my attitude, but I think it helps us more, like having doctors hear that this is a real thing and that people have these struggles, and we're really, really good at being fragile. Meaning, like, if I have an injury in my foot, I just stand on the other foot and I can hobble around, and no one would know I'm injured because I'm
Right.
really good at being injured.
Oh,
That's
I can
all.
totally feel that.
Yeah, totally.
It's so normal.
But it doesn't mean it doesn't. Yeah, so I'm really good at it. I have 10,000 hours into being injured for sure. I'm an expert at it. But it doesn't mean I don't need doctor's help
Right.
or some medical advice once in a while. Yeah,
Yeah.
some thoughtful collaboration, but that doesn't seem to happen that often.
Right. So, living for 40 years with vEDS, or actually 45, what is
Yes.
something that you would tell somebody who is younger and living with vEDS?
Hmm. It's interesting. It's an interesting question. I guess I would say, that really vEDS is such a small part of your brain, for example. I mean, vEDS is just such a small part of you. It feels like it's all of you, but it's not. I mean, you're able to make other people laugh, and you enjoy the sunshine, and there's so many things that life is about that I would focus more on that and just, let life unfold how it unfolds. If that means you have to go to the emergency room, okay, that's what it means. Or if it means you have to keep canceling on your friends, okay, that's okay. I mean, you'll get through it. You're just still you. There's so many parts of you that are not vEDS, and just focus on those things. And don't be hard on yourself.
That's a great piece of advice.
Good, I hope.
Yeah, I love that.
I have mentored some young girls over the years, mostly with anything that they want to talk about, of course, but it's almost always sexual questions. It's kind of funny. They always want to know about sex and how to do it, and is it going to hurt, and will they have bruises, or why do they have bruises from sex, and is that okay, and do they have to tell their parents?
Oh my gosh.
I know, it's sweet. It's sweet. I mean, there's a
That's
lot
sweet.
of personal questions people have. It's
Yeah,
a
and
lot to
that's
deal
one
with.
that I don't think people bring up a whole lot
Hmm.
is sex, especially with beds.
Yeah, I agree. I mean, sometimes it's fantastic, and other times it's not that great. It hurts. It can hurt for sure.
Yeah.
Ugh, and
Well,
always had a hickey when I was in high school. I
oh
don't know
my
what happened to me.
gosh, I swear, somebody can just like kiss me the
I
wrong
know.
way and then I
I
have a freaking
know.
hickey.
It's so embarrassing.
Oh my gosh, my ex-girlfriend loved to give me hickeys. But she loved it. I'm like, stop.
I know. That's funny. I've attracted some people as well that seem to have almost like a bruise fetish, where it's like, oh, watch you bruise. Look at that. And it's
Oh
like, no,
my
no, don't
gosh.
do that.
So what has it been like dating with vets for you before you met your husband?
Uh, yeah, it was pretty complex, I'd say. Um, in my early 20s, I was living in Chicago. I had great girlfriends. We'd watch Sex and the City every Sunday night together, so we really thought we were hot tamales. But, and we would go out a lot. But, when do you say this to this person who's also 25? If we're both 25 and we're looking just to have fun, does it matter if I'm sick? Do I have to share that with him?
Mhm.
Does, I don't have to, but then when we're intimate, if there's bruising that's happening, you know, you don't want to scare the guy. So it would always come up sometimes, but just in a very top line way. Yes, I'm fragile. Yes, I have it under control. It's none of your business, essentially. But then when you get serious, you kind of have to say right off the bat at age 27, I'm not having children. So just so you know. And a lot of guys were not up for that. A lot of this one guy I was madly in love with walked away. So you just, have to be honest and ready, and it's really complex though. And so they ended up dating my boss, who I'm now married to. And he just provided everything I was looking for. He had a vasectomy already, he had grown children, he was mature enough to know how to love living life, and wasn't so worked up in like milestones, like
Mhm.
having this job by 35 and this much money and this for retirement. None of that. He was older. He was much more advanced. And it kind of just synced in well with what I was looking for. So I recommend dating an older person for sure.
Awesome. That's a great recommendation.
Okay.
I'm glad that you like I had a similar experience, very recently, so it's really cool to hear you say that because it is harder to
Good. I'm
relate
so
for me
glad.
to people my age when dating.
For sure.
Oh,
We're just so our lives require a sense of maturity that other people don't have to have at all. They don't have to worry about these things.
yeah. Well, thank you
At
so
least not
much.
at 30. You're welcome. Thank you. I hope it's good. If it turns out bad, we'll do it again because I get
Okay.
nervous.
I want to. I think you did great. I want to
Okay, good.
apologize to everybody listening for all of the background noise on my end. I'm trying a new place on recording, and clearly this was not the right location. So you might have heard an ice maker, cats fighting, a dog whining, and then a cat trying to get out of a room that I locked him in after he got in a fight. So I apologize
An
for any of
eventful
those
day.
background noises. And I hope that it doesn't take away from anything that you had to say because I think everything that you said was so important.
Oh, good. Well, Katie, thanks for all the good work you're doing for our community. It means a lot.
Thank you.
You're
Thank you.
welcome.
And I'm so glad I got to meet you, and I look forward to seeing you
Me
again, hopefully
too.
soon.
Me too. Let's do it.
All
We'll
right.
figure it out. Okay, Katie, have a great weekend.
You too. Thank you. And thank
Okay.
you, everybody, for listening. This was Staying Connected. I have episodes coming out on the last Sunday of every month. So go ahead and hit subscribe and share this podcast with other people, especially if they're interested in vascular Ehlers-Danlos syndrome. So have a great day, and I'll talk to you soon.